Dear distinguished participants, welcome to the fifth of the medical webinar series conducted by the Global Healthcare Travel Council and presented to you in cooperation with the Nearis University. All webinar series are broadcasted live on the official YouTube channel of the Nearis University and the Global Healthcare Travel Council. Our guests in today's webinar are Associate Professor Dr. MEHTAP MALKOÇ and Assistant Professor Dr. İLKER İPEKDAL. They will share with us their invaluable expertise on current options and future strategies for epilepsy treatment and physiotherapy applications in seniors. As our first speaker, I would like to invite on the stage Assistant Professor Dr. İLKER İPEKDAL to make his presentation for us. Professor?
Okay, thank you very much. It's my pleasure also to participate in this organization and hope a nice webinar for every audience and participant. Now, my presentation is, the name of my presentation is Current Options and Future Strategies for Epilepsy Treatment. Just for intro, I would like to make everyone remember that all the universe or the existence stays on a very nice balance, and if some imbalance happens, some problems and diseases occurs. So in medicine practice, as a professionals, we have to help individuals to maintain this balance, to protect this balance. So we can say that balance is the key to life. And our neurons in the brain has spontaneous firing activity, and with the help of this, group neurons make group discharges and make some functions. These functions also represent their properties as imbalance, and one side of the balance, there are some inhibitor mechanisms that rests the activities, which are maintained by, we call it gamma aminobutyric acid, glycine, chlor ion, and potassium ion. And the other side of the balance, there are some excitatory mechanisms, such as maintained by aspartate and glutamate. These both, and also sodium and calcium ion, these both inhibitory mechanisms and excitatory mechanisms in the brain works in balance. If there is some triggering factor occurs and causes imbalance of this system, such as mainly decreases in inhibition. If inhibition decreases, relatively excitation increases, or if excitation increases, relatively inhibition decreases. But if this triggering factor causes imbalance, this will make a domino effect in these spontaneous firing neurons, and this will cause seizure in clinical practice. And if these seizures continues and repeats, we call it as epilepsy. So we can define seizure as a clinical manifestation of sudden, abnormal, uncontrollable, excessive or hypersynchronous neuronal activity in the brain. There is some slight difference between seizure and epilepsy. Seizure is a clinical phenomenon. Epilepsy refers to a condition in which a person experiences 2 or more seizures, and only 25% of people who experience seizures have epilepsy, because more than 2 and more seizures must happen in a person, and there must be time gap at least 24 hours between these seizures, and it mustn't be provoked by any same reason. So epilepsy is a disease. Seizure is a clinical manifestation. So we call epileptic patient if patient has more than 2 seizures and independent times. There are many causes of epilepsies, and anything that disturbs the normal pattern of neuron activity, any illness, any disease, or developmental problems can lead to seizures. And unfortunately, great proportion of the more than half, 2 out of 3 portion of the reasons are still unknown. But there are some congenital, developmental, vascular regions, trauma, tumor, some degenerative diseases, and infections are generally the main causes of the epilepsies. But we must, again, I must make you remember, more than half part of the reasons are still unknown. And yes, we can see epilepsy any time period in our life, maybe more in childhood time, a little bit more again in the elderly time, but the risks are nearly the same. Shortly, I would like to make remember the classification of epileptic seizures, but mainly there are some, we generally divide into two, which are partial focal seizures that arises from a focal part of the brain area, and generalized seizures, which are mainly spread or starts and quickly spreads to every part of the brain and cause big seizures. And there are also some unclassified seizures. The clinical presentation, manifestation of epileptic seizures depends on where the excessive discharges or problems happens. So just to make you remember, we have homunculus, which represents the function of our body parts, and it reflects to the brain areas. And so as motor neurons and sensorial neurons. So the clinical presentation of the epileptic seizures are directly related where the source focus are located. So we can classify again epileptic seizures like partial seizures, which are mainly started from some part of the brain. The signs may be motor, sensorial, or autonomic signs, or some psychiatrical also symptoms. But in these partial seizures, in simple ones, there is no alteration of consciousness. Patient still remains conscious. But if we call it complex partial, complex focal lesion, focal epilepsies, patient loses their consciousness. And other generalized seizures, as I said before, this all the neuronal activity makes a domino effect and spreads all part of the brain, and it causes generalized. It can be convulsive or non-convulsive, means it can be a big seizure that patient loses their consciousness and falls down and make great generalized tonic-clonic seizures, or also patients may freeze, or some jerks, uncontrolled jerks may happen, or muscle tonus may lose quickly, suddenly, and this may cause seizure. But this is all generalized seizure, and patients lose their consciousness. And there are also the third classification is unclassified epileptic seizures, which are special type of epilepsies. In the diagnosed epilepsy, we have some tools, but the main simple one is, yes, we have to take the history of the seizures from the patient and the relatives, and who sees the seizure. And we examine the patient physically in detail, and we make blood, urine, or maybe cerebrospinal fluid tests. Electroencephalography, EEG, help us to see the brain function in some period of time. Sometimes we take this sample in a prolonged time. Generally, EEG performed in 20 minutes, but sometimes we take 24 hours or 72 hours or 1 week period of EEG monitoring also we can make, or we can also make EEG monitoring outpatient. And EEG video monitoring we can make, and some there are important imaging techniques such as computed tomography, brain MRI scan, PET-CT or SPECT-CT. We generally use these tests according to the patient's complaints. EEG is we record the patient's individual's brain activities. We put some electrodes just on the scalp, and we record the brain activity. As you see here, there is an abnormal discharge of the right side of the brain, just anterior part a little bit. and we see these some epileptic discharges coming through these areas. So this is very helpful, but only EEG is not a diagnostic for us. It helps really quite much for diagnosis. And the gold standard method, which is video EEG monitoring, the gold standard method in the diagnosis of epilepsy is video EEG monitoring. It means we record the patient's behaviors, we monitor the patients just at the same time while we are recording the brain activity. So we can discuss, we can make some connection about the patient's behavior, patient's movements, eye movements, leg movements, head movements, all activities, and we refer to the brain recording, and we try to see during the abnormal discharges what happens in the patients at the same time. So this is our gold standard method to put the diagnosis for epilepsy. And imaging studies help us to see some lesions in the brain, such as computed tomography, some hematoma, some bleeding, some stroke event, or some tumor, some trauma, sequelae, or hydrocephaly, like structural lesions. And SPECT, it is hard to make, but sometimes in some selected cases, if we make IPEKDAL during the seizure, if we make SPECT, we can see hyperperfusion, increased blood flow where the seizure located, where the seizure is happening. So we can put the diagnosis 100% during this test, but it is a little bit hard to perform. And just after this quick summary, we can now pass through our main subject, which is current treatment for epilepsy and future strategies. In the treatment of epilepsy, our main goal, there are some main goals and in the treatment, and these are, we have to focus on reducing the frequency and the severity of the seizures, so we can increase the quality of life of our patients. And then giving medication is important, but the most important thing may be to avoid from the side effects of the medication, because we have really cardiac, also mental, or liver, kidney, or other organ side effects may occur during the medication, drug treatment of epilepsy. So, or other kind of treatments, we must be careful about not causing side effect during the treatment. So our three main targets, we have to reduce the frequency and severity, we have to increase the quality of life, and we have to minimize the side effects during the treatment. So the main treatment, the mostly we used worldwide treatment is medications, anti-epileptic drugs. So from more than 100 years, we are using medicines, drugs for epilepsy treatment. And the main goal of this treatment to make the brain activity stable, and to suppress the excessive discharge, to suppress the excitatory mechanism, and to help the inhibitory mechanism, and to maintain the balance of the brain. So we can prevent or reduce the seizures. There are many types of anti-epileptic drugs available, and the choice depends on the seizure types and patient's age, general health, and possible side effect and other health conditions of the patients. So when we use anti-epileptic medication, if patient has 2 or more seizures in 6 months period, or as I said before, if independent 2 seizures patients has, and some laboratory findings, family history, and other clues supports the epileptic epilepsy, so we decide to start anti-epileptic medication. Unfortunately, many of the anti-epileptic drugs can suppress the seizures, but it is a little bit hard to cure all the seizures. So mainly the curability of the epileptic patients with epilepsy, with anti-epileptic drugs, maybe 20%, 30%, but 70 to 80%, we can control the seizures in a normal level. The main aim in anti-epileptic medication must be stay on the same medicine. We call it on a single medicine. We call it monotherapy. And if we cannot control with monotherapy, while although we increase the proper dosage with that medicine, we can consider adding the second one, which is called dual therapy. And now we worldwide use epilepsy treatment is anti-epileptic drugs, and as you see, there are some milestones in epilepsy treatment. It starts from 1850s, and when phenobarbital 110 years ago nearly started to be used in epilepsy treatment, and then a big increase after, especially after 1990s, many treatment options, many chemicals that affects some mechanisms on the brain to control the seizures are produced by companies, and they are still studying on these medicines, and it's a growing new medicines which are called third generation drugs. And we use these medicines according to the seizure types, and there are some there is a simple list of a table of these medicines. We generally what seizure, which medicine we prefer. There are some first line preferred, second line preferred, or supportive treatment, second treatment, additional treatment we can consider according to the mechanisms or seizure types. And it is not treatment, but it can also be considered as a treatment, and which is ketogenic diet. And because in some patients there are some our brain directly affected from the blood glucose level. There is no specific transporter, and our brain cell glucose level in the brain cell directly affected from the blood glucose level. So if there is a glucose transporter deficiency syndrome, the uptake of the glucose in the brain from the blood is impaired, and brain suffers and cause epilepsy, or it become easy to have seizure. So the ketogenic diet is a very important part of the epilepsy treatment. It helps also many other health conditions. The main part of the ketogenic diet is high amount of fat, low to moderate amount of protein, and very little carbohydrates, because the carbohydrate level directly affects the brain activity. So ketogenic diet is very important because it affects on the epileptic mechanisms, dynamic methylation, histone acetylation, and RNA expression. And this ketogenic diet has proven anti-epileptogenic effect. Also, ketogenic diet has some neuroprotective mechanisms with regulation of amino acids, lowers the inflammation, lowers the oxidative stress, and regulates the apoptosis process and some neurotrophic factors. So this indirectly causes anticonvulsant effect. But ketogenic diet for the last several decades become more popular and used many other diseases such as obesity, cancer, other malignancies, hypertension, cardiovascular diseases, respiratory diseases, Parkinson, also diabetes, and also Alzheimer's diseases. Ketogenic diet is an important part of the medicine. And the other widely used treatment option is surgery. But the surgery is considered when we can see only single focus, and we can prove that epilepsy comes from that focus. And it is not the first line of the treatment, because we don't want to give our patients harm, because surgery, I will tell, may not cure the epilepsy, but the first line treatment always must be medical treatment. And when we consider surgery, at least 2 anti-seizure medicines have failed to control seizures. Sometimes we increase 3 or 4 medicines also. But after 2 medicines, if we cannot control the seizures, we can begin to consider about the surgery if we can find the focus and we can prove the focus is there. And also, in addition, if we can see some tumor that causes epilepsy or vascular malformation or other brain diseases, and we can reach there, brain surgeons can reach there, we can consider also as symptomatic epilepsy, and to control the epilepsy, we can also direct the patient, evaluate the patient as surgery candidate. There are many surgeries which are invasive, non-invasive, removing the brain, or altering the brain. So, on one hand, you see in green, resective, curative procedure. We take resective in epilepsy surgery. There are some resective procedure, and in blue one, functional palliative procedure. So, in resective procedure, brain surgeons generally take some part of the brain which are related with the epilepsy. We call epileptic focus, or to lower the severity of the seizure, which are, for example, temporal lobe surgery, removing some part of the brain means, and hemispheric surgery. Hemispherectomy means you disconnect 2 hemispheres and you try to increase the quality of life of the patient, generally used in generalized tonic-clonic seizures. And other functional procedures, palliative procedures, are again corpus callosotomy, some small transections, cutting the neuronal networks and cutting the shortcuts, and trying to lower the intensity and severity of the seizures, and some neural stimulation therapies I will explain. And if patient has uncontrolled intractable seizures, although they are using 2 or more medicines and cannot control the seizures, they are candidate for the surgery. But we evaluate step by step, and at the first phase, we generally we have to evaluate patient with imaging studies, video EEG monitoring. We have to see the seizure, and we have to find the focus. During the video EEG monitoring, we have to see the focus at the same time. You have to record the focus, and we have to be sure about the focus, and that matches with the MRI scan. And we have to make neuropsychological tests, NPT written here, neuropsychological tests, because after epilepsy surgery, patients may suffer from some psychiatric problems, as you remove some lesion, or if you remove some brain part, we have to consider whether it will cause some psychiatric side effect or not. And other SPECT, magnetoencephalography, PET, functional MRI, also helpful tools for us to determine the candidate for epilepsy. And after all collecting these data from the patient, all professionals multidisciplinary approach, make a multidisciplinary approach and evaluate the patient. And if this consultation is safe, we have 2 options. If we determine the single focus and we are sure that that causes epilepsy, you can make resection, or with laser NIV technology, interstitial thermal therapy, you burn the focus. Or if you cannot be sure, if you cannot localize the focus, so you make some further intracranial monitoring. You go fast to second step, and you put electrodes like strip electrodes, grid electrodes, or rod electrodes, and you try to find, you make invasive monitoring, and you try to find the focus. And if you cannot find the focus, or you poorly find the focus, so if you are sure that you couldn't find the focus, so you can make some, you can consider some neuromodulation treatments. In surgery, what are the surgery options? We said corpus callosotomy, There is a corpus callosum here, which binds two hemispheres. If you count these nerve fibers, so seizure cannot spread from one side of the brain to the other side of the brain. So you control big seizures. And there are here one sample of anterior temporal lobectomy, this side of the brain removed and surgically, and you see the empty space here, and patient become less seizure free or totally seizure free. And laser intensive thermal therapy is an old treatment, but newly well known. And like gamma knife, cyber knife, you focus on the laser to the lesion and you burn the lesion. But this is new ongoing technology. And deep brain stimulation or responsive neurostimulation, which is deep brain stimulation is a little semi-invasive, less invasive, and responsive neurostimulation is a little bit invasive, but both is stimulation of the deep brain structures and to inhibit the neurons by stimulating by giving some proper electrical currents to some specific brain areas, and you control the seizures electrically, maintained by some devices outside, as you see here. And generally, 20% to 60% you can control the seizures with these procedures. And one of the well-known treatment of surgery is minimal invasive surgery is vagus nerve stimulation, and more than 100,000 people has vagus nerve stimulation. I also experienced this in my patient with oncologist. And it shows its efficacy nearly 50% of reduction in epileptic seizures. And we generally prefer this technique patients who feels their seizures are coming, so they can also stimulate the here wire and send impulses through the vagus nerve to the brain. And when vagus nerve make a big discharge in the brain, it also by the help of this, it suppresses the brain activity and it turns the potential to resting potential. So a kind of resetting the brain, and it protects from the seizure. And another one is transcutaneous vagus nerve stimulation, is a device that uses outside the ear one vagus nerve branch that goes to the outer ear, and you apply there. And you can also use this in some specific patients, and you can control this 50% reduction in seizure frequency. And this trigeminal nerve stimulation also used in 2000, at the beginning of the 2000s, but it didn't become popular. But if you give some electrical currents to the trigeminal nerve, also it is used in migraine treatment. And you, in selected patients, it is a little bit hard to use because you have to put at least 12 hours a day, nearly 6, 12, 18 hours. Study says that. And you can reduce the number of the seizures more than 50%. It means that if you stimulate the nerves, this trigeminal nerve, the branch of the trigeminal nerve, you can also control the seizure. And this is also promising technology. Maybe wearable devices, maybe in the future, maybe made and maybe widely used. And transcranial magnetic stimulation, especially repeated transcranial magnetic stimulation, is also has a potentially promising effect on modulating the neurons, because in high frequency, more than 5 Hz, excitates the brain, has excitatory effect on the brain neurons. Low frequencies has inhibitory effect on the neurons. How it shows its effect? This coil quickly, there is a wire in the coil, and when you give electrical current to the coil, from this hole, there is a magnetic area happens, magnetic field occurs there, and this changes in the magnetic field causes neuronal discharge, and it helps modulating the neurons and decreases the excessive fire activity. So it is painless. That this trigeminal nerve stimulation is a little bit painful, but this is painless procedure, and this has also promising effects. Maybe in the future, small devices, wearable devices may be established in the future. And in some future strategies, we know that in 1980s, FDA approved cannabidiol, which is produced for cannabis. The trade name is EPILEPSY, approved by FDA, and it began to use in some specific type of epilepsy syndromes in patients 1 year of age or older. In some, these are also effective in controlling these seizures. So this cannabidiol began to widely use or take some indications in the future for different kind of epilepsies. We are expecting so. And these are the future strategies and still under investigation. But there is one theory. This is blood vessel and this is brain. There is a barrier between the blood and the brain. We call it blood-brain barrier. And if there is an inflammation in all our body, inflammation may happen. And also many after removing the epileptic focus, when they send it to pathology, they see under the microscope with specific examination, they saw that there are some inflammatory process in that epileptic focus. So anti-inflammatory or neuroinflammation or and neuromodulation by reducing the inflammation may help lowering the seizures, and studies are now focusing on this. So if there is an inflammation, blood-brain barrier opens, and there are some leakage from blood to the brain, and that brain inflammation may cause neuronal excessive discharge. And novel treatments target some mediators. Here, I've written the name, but it is very complicated. I read also current studies, and there are some interleukin signaling, prostanoid signaling, monoacylglycerol lipase pathway, COX-2 inhibitor, and prostaglandin receptor antagonist, just to suppress the inflammation. And these are promising strategies for future treatment of the epilepsy. And again, you see here oxidative stress, which we mentioned in ketogenic diet. Also, ketogenic diet reduces the inflammation in the brain. So this future strategy, especially suppressing the neuroinflammation, has a promising strategies for epilepsy treatment. And other promising strategy is stem cell therapy. You take from the same patient, and you take the cell, and you first I have to say that these recurrent seizures are associated with the loss of inhibitory GABAergic interneurons, because gamma aminobutyric acid has an inhibitory effect on the brain neurons, and the loss of inhibition causes seizure. And so when you take some cell from the patient, and in cell culture with some chemicals, also supportive chemicals, and you increase with fibroblast culture, you can also grow some cells that produce gamma aminobutyric acid, and you can again remodel the cell and give the patient, and you can like a new cell, you implant, you give the brain these cells which produce GABA, and you again maintain the balance and control the seizures. The theory is like this. And gene therapies are very, very huge area, and as we lived in COVID-19 pandemic, we learned how mRNA vaccines work. Nearly same manner, you take some target gene and take the DNA. You amplify the selected cells, DNA of that cells, and you transplant into brain, and you expression the genes in the central nervous system, and that produce inhibitory also again chemicals and rebalance the mechanism, and patients become seizure free. These are these are still there are some studies on this, and you also use these DNA genes to send to the brain. You use some viral vectors or some other vectors you integrate to the brain. And in 2020, Nobel Prize was given to the CRISPR, the biologists, chemistries, in chemistry, to CRISPR gene technology. CRISPR is the enzyme in bacteria, and they found this, and they cut the genes in proper ways, like a gene tailoring. With using this CRISPR technology, you can cut the genes in proper segments, and you can give the patients, you can give whatever you want, which protein you want, you give that code to the patient. And this is very, very new area in treatment of all kinds of disease, including epilepsy. So CRISPR will be discussed more. My expectation is CRISPR gene treatment will be discussed more in epilepsy treatment also. Yes, also, I didn't mention about the lifestyle changes, but as we know, when time passes, all the people around the world become more stressful, and we are using more chemicals, more pesticides, more insecticides, and we need healthy life. And our professor will explain, we need healthy exercise. We have to sleep properly, 7 hours sleep, night sleep without any light, in dark area, a dark room. This also protects our brain from epilepsy. So maybe lifestyle changes are still very important part, like ketogenic diet, our eating habit, microbiota in the guts. We have to focus on lifestyle changes, including our eating, drinking, artificial foods, or some foods that contains pesticides, insecticides, or other chemicals, and proper exercise, stress control. And under the stress control, there are many subtitles, and one of the subtitles, a big title, is maybe healthcare tourism also. And we have to focus on this. We have to be in nature. We have to try to mimic the nature maybe. And when we combine new strategies with a good lifestyle changes, we will be able to control the seizures, maybe get rid of these many of the seizure types in the future very well. Also, artificial intelligence, using artificial intelligence in epilepsy diagnosis and treatment. Also, artificial intelligence process will help us to find the proper patients for proper treatment, and in the future maybe we will be able to see these positive effects of artificial intelligence usage in the epilepsy treatment in the future. Thank you for listening, and have a nice day. If you have any questions, I will like to try to answer. Thank you.
Thank you very much, Assistant Professor Dr. İLKER İPEKDAL, for your presentation. I'm sure your contributions is going to be very valuable to our participants.
Thank you.
And if there are any questions at the end of this webinar, we will share the questions with you. Thank you very much for your presentation.
Thank you. Yeah.
As our second guest speaker, I would like to invite on the stage Professor Dr. MEHTAP MALKOÇ to make her presentation. The topic is physiotherapy in seniors, and the bottom line is, the headline is the importance of exercise for a healthy aging. Professor MALKOÇ.
Thank you very much, dear moderator, esteemed participants. First of all, I would like to thank all the organizing committee for this beautiful organization, and of course, I would like to express my heartfelt thanks for their kind invitation. Today, I will try to convey physiotherapy approaches in the elderly. And as we know, aging or getting older is the natural cycle of life. The world's population is aging, and the number of adults over age 65 is expected to double in the next 20 years. So increased life expectancy is a key factor contributing to the aging of the population, and that's this reason promotion of health span and healthy aging is a global priority. And right here, if we look at the differences between aging or getting older, we need to talk at healthy aging first. If we talk about the difference between aging and healthy aging, we need to talk about it from these three perspectives. The first one is health. And as we all know, health is actually the key here. The World Health Organization has defined healthy aging as the process of developing and maintaining of functional ability that enables well-being in older age. And at this point, active aging can be measured at 5 levels. We can argue that active aging is a higher order construct consisting of 5 categories. One of them is personal characteristic, and the other is health, and of course, governmental and socio-economical characteristics and place-related condition. So active aging is a process. This process optimizing opportunities for health, participation, and of course, security. At this point, if we are talking about healthy aging, we should also talk about the natural changes that occur in our body with aging. What changes happen to our bodies as we age? First of all, these changes start to occur on a molecular level. And then we can see that balance and postural mechanism impaired, also functional disability appear, and nutritional disorders and impaired adaptation to stress is the other changes of aging. And if we summarize all these changes, aging or getting older makes our body go through many physical changes. These changes usually cause a decrease in muscle strength, bone density, body coordination, and even make the joint stiffness, which sometimes can lead to falls and fractures. And when chronic disorders, conditions such as diabetes or pulmonary problems or cardiovascular problems, and etc., added all these things, the person becomes functionally dependent. So, at these changes, lead to a circle, which we call this circle of this fitness circle. As you can see here, age-related changes leads disease risk factors. Of course, if we have an inactivity, and these increase our disease risk factors, and all this circle continues to the other problems. So our biggest goal in healthy aging is to build this circle first. And if we ask the role of the physiotherapist, if we look at the role of physiotherapists in elderly, in seniors' life, first of all, we need to emphasize that all our approaches in this population are symptom management or symptom based. We have to comprehensive maintenance. We have to coordinated interprofessional, and we have to look at the individual and family care also. And the importance of physiotherapy for elderly people, as we can see here, is an essential component of healthcare for elderly people. Physiotherapy can help all these problems and improve their overall health and well-being, and of course, improve quality of life, improve well-being. And what is the aims of physiotherapy? As we can see in this crowded slide, the physiotherapist has many purposes in this population. Physiotherapy is vital for restoring functionality, reducing pain, and thus improving quality of life, and has many roles in geriatric rehabilitation. So, at this point, we can divide into four big categories our aims. First, we have to improve mobility, and physiotherapy can help improve muscle strength, body balance, coordination, and which can lead to better mobility and reduce risk of falls. This is our the biggest goal. And the second one, manage the chronic condition, especially systemic inflammation in the body. Many elderly people have chronic conditions such as arthritis or heart disease that can affect their mobility and quality of life. Physiotherapy can help manage this condition and alleviate the symptoms. And the fourth thing is for elderly rehabilitation is pain management. As we know, the elderly people always make a compliment that they have a pain. So, physiotherapists can use a range of techniques such as massage, stretching, and exercise to help reduce pain and improve mobility. And the fourth and more important issue is reduce the risk of falls. Falls are a significant risk for elderly people, and physiotherapy can help reduce this risk of by improving balance, strength, and coordination. At this point, we should also have talk about geriatric rehabilitation and geriatric physiotherapy. Geriatric physiotherapy is a form of physical therapy, specially geared toward older adults and their problems and challenges. So, as I mentioned before, geriatric condition, including musculoskeletal, neurological, and cardiopulmonary problems or mental mental illness, balance problem, and chronic pain. So physiotherapy treatment has been successful in manage each of these alignments. Moving forward, we can start by revisiting the concept of rehabilitation in physiotherapy practice. As we can see here, traditionally, rehabilitation has been conceptualized as either remedial or adaptive. So, remedial rehabilitation focuses on restoring capacity. For example, improving muscle strength or retraining lost skills. Adaptive rehabilitation aims to compensate for lost or absent capacity and focuses on providing assistive equipment. And at this point in geriatric rehabilitation, a detailed, comprehensive evaluation is of most important before starting our program, our physiotherapy approach. According to the results of this evaluation, the physiotherapist draws a personalized treatment plan. There are three main approaches to physiotherapy in the elderly program. One of them is exercise, prevention, the other things, and pain control. So, I will focus more on exercise in my presentation. The benefits of exercise are well known, not only in the elderly, but all age groups, and have been supported by scientific research for many years. We all know that there is a close relationship between physical activity level and falls and fractures in elderly people. And also, decrease in physical activity or physical exercise or physical fitness, all patients, not only geriatric patients, increases the number and frequency of chronic diseases. So, what kind of program should we plan first of all of this patient? There must be a structured, personalized program, and most important thing should be turned into the lifestyle. Lifestyle is very important in this situation. And no matter how old is he or she, we have to find answers to the following questions. What are these questions? First of all, what are the expectations of the patients? Patients' needs and also risk factors. Maybe cardiac, maybe orthopedic, maybe neurologic. We have to evaluate detailedly, and also we have to know risk factors. For example, if the person have hypertension, and if so, what kind of treatment is she or he receiving? Especially in the elderly people, we should be very careful about the use of multiple medications, because these medications may have adverse effects on each other. And also smoking or chronic disorders, for example, diabetes, and family history, and other risk factors. We have to know all these factors. And if we look at the structure of the exercise program, we have to mention the FIT principle here. The FIT principle is very important in exercise programs. What this means is that the exercise should have a frequency, intensity, type, and also time. And we have to start first, and in elderly people, in seniors, we have to start and increase frequency first. For example, if we start 3 days in the week, we have to increase frequency 4 or 5, and the adaptation may occur, and then we increase frequency and duration and the step, and at the end of this our step, we increase frequency, we increase duration, time, and of course intensity. And the intensity of exercise in this population is usually between 55 or 50 and 75% of maximal heart rate. And we should prefer mild or moderate exercise in this population for healthy aging, for well-being. And while our exercise program should consist of aerobic exercise, such as walking, such as swimming, or sporting activities, it should include also resistive exercise, strengthening exercise 2 days a week. And in elderly people, we have to give them balance training. This is very important for them. And we make a proper exercise prescription. As we can see here, you can see here American College of Sports Medicine recommendation. As we should definitely start with 5 and 10 minutes warm up period before the starting exercise in all individuals, not only elderly people, all individuals. This is a period of great importance, as you know, for people, body system to prepare for exercise. Of course, not only warming, but also cooling period is important also. And we graded from low to moderate severity. And if we have our goal is weight loss, at this point, we have to give exercise 30 minutes all of the week. This is very important for lose weight. And at this point, we can divide into big core type exercise: aerobics, resistive, and flexibility and balance exercise program. And I will talk about what is the importance of these type of exercises. And here you can see endurance training. As we can see here, endurance training is very important for our body, for decrease blood pressure, improve lipid profile, and cardiac mortality, decreased cardiac mortality. So we have to give them 30 minutes 5 times a week, moderate exercise. And we have to be very careful. We have to monitoring the patient's SpO2 and monitoring of vital signs, and pay attention to the pain threshold in the patient with claudication, and watch out for the fatigue is very important. And flexibility training, again, is a important things in geriatrics patients. And as you can see here, you can see here, we can do this exercise, dynamic or static type. And self-management is very important for dynamic stretching, and we have to be very careful to the endpoint, pain threshold, and not overstretch the body. And but the benefits of these exercises is still under work. A lot of work is needed in this population. And resistive exercise or strengthening exercise training is the most important aspect of this patient. As we can see here, also we have to be very careful breathing for these exercises, because if the patient hold the breath, it is a very big risk factor. We have to count, 1, 2, 3, and behavior expected to take a breath. And we have to be a multiple joint exercise. We have to be functional in this exercise training. And as you can see here, we can use chair exercise, we can use bands, we can use resistive models and resistive machines. And we have to use first single joint exercise, and after that we increase functional exercise, and avoid isometric exercises is very important in these patients. And here you can see the resistive machines. In these patients, we have to be very careful for the joint disorder. So we choose closed chain exercise. In this here, you can see here, the patient push the legs. This name of exercise is closed chain exercises. And the other important exercise in this population is balance training. And in these patients, we have to give them static balance, dynamic balance exercises, as you can see here. And the most important effect of balance training is to reduce and even prevent falls, which cause significant morbidity and mortality in elderly. And for this reason, it is very important to include balance training in the exercise prescription of elderly people. We have to pay attention to pain threshold again, and we have to be very careful. The benefits of these exercises is the big effects of this exercise: decrease risk of falling, and increase also muscle strength, especially lower extremity muscle strength, and increased functionality in this patient. And if we take a look at education, you can see here that we can do it very simple. We can use only a chair, and we can use this stable surface, spare positions, and then we can use different resistive surfaces, and we can decrease the resistivity on floors with different slopes and different resistance, progress from simple to complex situation. And if we take a look here, we can use a different site of exercises. First, we use open eyes, and then we close patient's eyes, and also here we can use these exercises on the platforms and different assistive platforms. And we can do it using more expensive equipment if we have, which we can only do in a laboratory condition. And at the end of our program, we can use this kind of dynamic balance training. Here you can use, we put the person legs on this platform, and we want her or him to stand gravidity, central gravidity, and she can see where is she. And this is very important and good exercises for dynamic balance training. And also mobility education is very important. We can use walking exercise, we can use step exercise, and with eyes open and with eyes closed. This is very important for them. And at this point in my presentation, I would like to give you some information about the effects of exercise on dementia, which is the biggest problem of recent years in the elderly. As we can see from this study, studies on these subjects are not very new. It begins before. And now you can see here exercise, especially aerobic exercise, has many effects, benefits of this condition. It decreased depressions, agitations, and sleep disturbance in dementia. So this is very important to make exercise in our life, to change it, our lifestyle. It is very important of aging, a healthy aging period. And if we take a look another study, you can see here program standardization is very important at this point to evaluate the influence of exercise on brain, aging and dementia, and healthy economic analysis, investigation of duration, frequency, and intensity differences, and long up studies is needed still. And I am going to stop my presentation, but I want to give a little information about our modern physiotherapy approaches. In the last decade, there has been a growing interest in use of virtual reality systems, rehabilitation system, to implement programs for supporting the functional ability of older adults through physical exercise. It's a cognitive and social intervention. So rehabilitation system and virtual reality rehabilitation system is very, very important in our modern physiotherapy life. And in the last decade, there has been a growing interest in virtual reality, as you can see here. If we summarize at the end of my presentation to take home message, we can say that physiotherapist aims to help and address the areas which require treatment. The therapist uses his or her information to design a tailor-made program individual program. This is very important point. And exercises, workouts, and electrical modalities is very useful in geriatric population. And also moderate intensity activity like brisk walking and is recommended for healthy aging. And strengthening exercise for muscles can be done against resistance by using stretch bands, or we can choose another method. And this is very important thing, combination of moderate cardio endurance exercise and balance exercises in healthy aging life is the most important thing if we summarize as a message to take home. And as Einstein said that beautiful young people are the work of nature. Of course, beautiful old people are the work of art. And thank you for listening to my presentation. If you have any question, please ask me.
Thank you very much, Professor Malkoç, for your valuable presentation. And I would like to mention that we have very valuable, very wonderful comments on the YouTube regarding your presentations.
Thank you.
Professors. There's one question on the YouTube channel. One of the participants have asked. I guess this question is for you, Professor Malkoç. One of our audience is asking, is there a therapy called aqua therapy in physiotherapy?
Yes, of course. There is so many things in elderly rehabilitation, of course. And aqua therapy is another core component of our rehabilitation programs. We can use it. And in Cyprus, we are near the seaside, but we never use swimming. This is very important to take this population for swimming, for aquatic therapy. It's a very important part of our approaches.
I guess this has been very useful to the audience. The question was from India, actually. They have ocean, so they can apply as well, I guess.
Yes.
Okay. Assistant Professor Dr. İLKER İPEKDAL and Professor Dr. MEHTAP MALKOÇ, you were with us today. Thank you very much for your participation and your contributions. I would like to express one more time our deepest gratitude for you, for your contributions in today's webinar. Thank you very much.
Thank you. Our
next event will be held on 18th of January. The topics of discussion will be artificial neural network models for predicting in vitro fertilization IVF outcome and new methods in IVF treatment. Thank you very much for being with us today and hope to meeting you again in our upcoming webinar on 18th of January. Until then, I wish you good and healthy days.